Okay, so I am going to be talking about the health promotion theory. So Nola Pender actually created the health promotion theory in 1982. Her goal was to improve the patient's well-being ultimately. Pender formulated this concept after considering the factors that promote health practices and preventative initiatives. So the concept has undergone a lot of transformation since then, but ultimately through the transformations, it has become more effective. The purpose of the theory is to enhance a behavioral change, which yields very beneficial results. It holds the individual's encounters and characteristics play an essential function in influencing health itself. The theory's scope includes personal encounters and characteristics, behavior-specific factors, and behavioral outcomes. It helps individuals to achieve a higher level of well-being and identifies background issues that might influence somebody's health. These issues include ethnic and cultural ideas that are influenced by daily choices, and as a result, those daily choices ultimately affect that individual's health. There's four major concepts surrounding this model. The person is the main concept of the model, the person or the patient. Their attributes and encounters have a direct effect on the future decisions and practices involved. The person has to assess the influence they get from society and the environment that surrounds them. However, the environment should be healthy in order to promote good growth and happiness. And that's where nurses play a role. Nurses must actually act effectively in order to attain the desired results for the patient. The health promotion theory is mostly applicable in a healthcare setting, and it helps healthcare providers influence how much an individual patient shapes their conduct. And the theory is also essential in promoting health education for practitioners themselves. So it's important that the patient understands health promotion, but it's also very important that the provider themselves understands promoting health education, health promotion for the patient. So there's some various factors that are included in this model. Modifying factors include ideas such as biological and demographic situations. There's behavioral factors that includes a patient's experience with a specific activity. And a good example reflecting this is that if somebody had a bad experience with a dentist, they might not return back to the dentist again. And then as a result, their health is affected negatively from a bad experience. So that's their behavioral factor. Situational factors involve an individual's surrounding environment. Once again, for example, if somebody lives in an area with a lot of air quality pollution, then their health might be negatively affected for that. For example, they might have issues like COPD, and then health promotion must revolve around the fact of their environmental exposure. And then there's things that can't really be adjusted, such as age, gender, and racial background, and they're fixed factors, but health promotion also must revolve around the fact that these are fixed factors, and health promotion should still be approached to these patients. One of the main issues that some health practitioners still lack is adequate awareness about the theory itself, and then the implications on improving a patient's health. The problem is that where some trainees fail to pay much attention to this area, at the same time, some educators don't emphasize on this area, and then as a result, the trainees aren't properly being educated. The result is that health practitioners cannot appropriately assist patients to advance their well-being. In my personal experience working in an emergency department, I feel as though education is of utmost importance to the patients itself, but we're also working in a busy environment and being forced to take a large volume patient load. As a practitioner, we don't often take the time to maybe educate like we should. Education of safety awareness and health promotion prevents individuals from reoccurring visits in the ER. Furthermore, as I do my studies to become a nurse practitioner, I've been spending a lot more time in a family practice office. And I recognize now that education about health promotion has become abundantly clear, as patients need to understand the importance of why they're going through health promotion screenings and routine health maintenance. And as a result, health practitioners have to play the role of education to the patient in allowing them to understand why health promotion is so important. This is a study that was performed in Iran, and it looked at a group of Iranian individuals and their associated cultural backgrounds, as well as being previously diagnosed with hypertension, which required medication. The study monitored their blood pressure and also educated the patients of awareness of the secondary effects of not taking their blood pressure medication. This close education and monitoring found that an increased awareness of their health and the approaches to the health promotion and maintenance actually encouraged compliance with their antihypertensive medications. So as a result, there was an increase in compliance rate, and it kind of reflects the truth behind Pender's theory that health promotion and better health education will result in better patient outcomes. Another study shown here looked at two different groups that have been diagnosed with HIV. There was an intervention group and a control group. The intervention group received 6 one-hour educational sessions weekly based off of the Pender lifestyle. The control group did not. The group who actually received intervention on the Pender lifestyle scored higher in areas such as health responsibility, physical activity, nutrition, and stress management. And once again, the result of the study showed that an educated lifestyle ultimately provides health promotion and encourages positive health outcomes. So why is this important? It's important to address the issue because lack of knowledge ultimately derails the attempt to promote the patient's health. Failing to apply this theory could result in a situation where a patient cannot use individual approaches to improve their well-being. Also, awareness about the theory is important to sell nursing as an exercise aimed at enhancing health and wellness. Even though it is common to witness the problem in health facilities and societies that do not have appropriate training centers, one can witness the concerns in facilities that lack skillful workers. The problem is a global issue and it requires effective intervention. There should be efforts to combat health promotion. The efforts to combat health promotion should be a worldwide initiative. In the United States, health promotion has become a primary way to practice medicine. However, specifically in underprivileged countries, access to healthcare is limited and health promotion is severely neglected. A suitable way to ensure all healthcare workers are conversant to the theory is to facilitate training exercises. Health educators should take the initiative to conduct campaigns that sensitize their healthcare workers. Besides, healthcare facilities can allow their members to undergo various forms of training, or they can also invite experts to inform them of theory functions. The best way to address challenge, according to Butts and Rich 2018, is to train workers and hire qualified nurses. Training provides necessary skill and knowledge, while recruiting qualified personnel cut the cost of training. Bringing in qualified trainers and having classes and sessions on training is important to providing the best education to healthcare staff. Ultimately, this training will be reflecting on improved patient outcomes and positive health promotion. The theory is important as it requires nurses to understand how to promote healthy behaviors. It informs healthcare practitioners that understanding how the theory functions increases the chances of attaining suitable results. Furthermore, the theory can facilitate the introduction of awareness initiatives seeking to sensitize healthcare workers and can help to conduct evaluation programs to assess applicability.